Hi.
Oh, nice to meet you.
My name is Sarah.
My name is John.
How are you, John?
Good, I know yourself.
Alright, well, I'm the registered dietitian, and today, basically, I'm gonna help you create a new diet plan. I'm gonna just ask you several questions
Okay.
about your lifestyle, your hobbies, etc., all that.
Alright.
Okay, and then I'm just gonna do a couple recommendations. But first things first, so from the chart, have you always had problems with your hip?
Yeah, I've always had problems, but as I've gotten older, they've gotten worse.
Okay. And what side hurts you the most?
My left side?
Okay. Okay, so also, so you were induced with steroid diabetes, is that correct?
Yeah.
Okay. And does it hurt? Like, what's your pain?
I'd say my pain's around like a 6 constantly since the surgery.
Does it stay at a 6 or does it ever?
Yeah, it's like constant 6.
Constant? Okay, so basically I'm just gonna ask you very simple questions right now.
Alright.
So first things first, do you live alone?
No, I live with my wife.
Okay, so that's good. You shouldn't be alone right now. Do you live in a house, an apartment?
I live in a house.
In a house. Okay, is it 1 story or 2 story?
It's a 2-story house.
2 story house. Okay, and do you have a bedroom upstairs?
I have a bedroom upstairs and downstairs.
Okay, okay, so I do suggest for you to stay downstairs in the meantime.
Okay. Is that because of my hip? You just don't want to aggravate it, or?
Yes, you don't want to put too much pressure on your hip because then the wound will never heal.
Alright.
And then also it can make you sick later on. Transportation. How do you get to places? How do you go grocery shopping? How do you run your errands, etc.?
I've been having my grandson take me ever since the
Okay.
surgery.
So if you can keep doing that, I know it's a lot of pressure for him, but I suggest you find rides, not drive yourself because you never know as well.
Okay.
And do you exercise at all?
Yeah, I go on walks sometimes.
How long do you walk though?
A couple minutes, maybe 25, 30 minutes.
Okay, so you're gonna have to walk a lot longer than that now. Is that all you do though? You don't do
Yeah, that's about
anything
all I do
else?
now.
Are you employed?
No, I'm retired.
You're retired. Okay.
Yeah.
Well, do you have any hobbies?
I used to like to shoot guns a lot, and I like hang out with my grandchildren, but that's about it.
Oh, okay. So you can't be shooting guns for a little bit, you know. After, once you're all better, maybe you can do that. And for your grandkids, are you having to pick them up all the time, like physically?
No, they're older now.
Oh, okay, then that's good. Health-wise, do you have any dietary restrictions? Are you allergic to anything? Do you prefer to eat certain foods?
I'm allergic to kiwi and cauliflower, but that's about it for my allergies. But I like to eat like chicken, ground beef, steak, like a lot of meat and all that, some veggies here and there.
Okay. Well, that's good as long as you don't eat a lot of. Do you use a lot of oils? I should say.
I cook my meat with vegetable oil.
Vegetable oil? That's okay. The amount of meals you have a day. So how many you consider? 3 meals a day, 2 meals a day? Depends.
Sometimes I have 3, sometimes I have 2, sometimes I have 1. It just depends on what my day offers me. If I have time, I have 2 or 3, but most days 1 or 2.
For those meals, is it more like snack meals or is it like
It's more full meals.
full meals? Okay. What is a regular meal that you do have?
A regular meal
Yeah, like what do you regularly have?
in the morning, I'll usually have eggs with oatmeal and some berries, some grapes.
And that's whenever you do breakfast, right?
Yeah.
Do you ever have lunch? Because a lot of people don't have lunch all the time.
Some days I skip it, but I try to have lunch most days.
Oh, okay. And what do you have for lunch?
I have an avocado and turkey sandwich every day. A glass of orange juice.
With all honesty, how many times do you eat out? Restaurants?
Fast food or?
No, everything. Like
everything,
restaurants?
I'd say like 1 to 3 times a week.
Okay, and where do you mostly eat at? Like do you-
Mostly fast food, like
fast food?
McDonald's, Burger King.
Okay, well, that carries a lot of calories, so you're gonna have to try to cut it out. It's gonna be hard, but you
Okay.
can do it, okay?
Alright.
Today we're gonna be focusing on your blood sugar, so with that comes a healthier diet and you're gonna regularly exercise, okay? So do you have any suggestions of what you should be doing, or tell me what you should?
For exercise,
Both.
for my diet, I'd like to have like chicken, ground beef, and like rice and veggies in my diet. That's what I normally eat, so
Okay.
that'd be fine. And for like exercising, I could walk my dog, or I have 2 little dogs. I can walk both of them.
If you have 2 little dogs and you don't have to really walk them, they're just basically there, that would be fine. But as long as you are not walking like a big dog.
I can't walk my big dog.
No, you cannot. Only because it could put a strain on your hip.
Okay.
Okay.
Alright.
Okay, so we're gonna set up a goal for you, and you're gonna have to lose 20 pounds in 4 months. It actually doesn't seem a lot, but it's actually gonna be very hard, only because you're not able to do a lot right now.
Mhm.
But you can do it. It's not really. It's gonna be hard, but it's not a big deal. Okay. And for your diet, we're gonna be focusing on nuts and veggies mostly. Okay. You can keep your meat. You can cook your chicken. I highly recommend you to stick with your chicken, and I know it's not gonna be good to like have it every single day.
Mhm.
But if you have to cook it in different ways, go ahead and do so. Just don't fry it.
Okay.
Because that's gonna be too much oil and everything. And
I'll
ground
just
beef is
season
not
it.
too bad.
I'll just season it differently.
Yeah, go ahead and season it. Yeah, okay, so today when you go home, how would you plan your meals? Like the rest of your meals, like your lunch, basically it's already past breakfast, but your lunch and your dinner.
My lunch, I can make that avocado sandwich.
Okay.
And then for dinner, I would probably make some chicken with broccoli and rice, or potatoes, mix it up, or no carbs, huh? So then, no potatoes, just chicken and broccoli, mix it up with the vegetables every once in a while.
Okay, okay. And do you have any best workouts? What do you think is best for you?
I think walking my dog would be best for me. I think it's my best workout.
Okay, because
Okay,
as
good.
you're, I'm sorry, go ahead.
I'm saying that's the best workout I think I can think of.
Oh, okay. Because as for your new workout plan,
Mhm.
we're gonna have you walking at least 1 hour every single day. And since you said that you have a 2-story house, you're gonna be going up the stairs and down at least 3 times a day as well.
Alright.
Because I know you can't really do much, but that means you have to be walking longer and moving much more
Alright.
to lose those 5 pounds.
So for the walking an hour, I can just walk my dog.
Yeah, you can go ahead. So instead of the 25 to 30 minutes that you walk right now, just walk the whole hour. You have to go around the neighborhood wherever you'd like. How long do you think it's gonna take you to really get the hang of everything? Like the new diet plan, the new exercise plan, your diagnosis?
I think it'll take like a couple weeks, maybe 2-3 weeks to get a hang of everything.
Well, it'll only take a couple of weeks if you are motivated. So that's like the very
I'll try.
important thing.
I'll try my very best to be motivated.
Okay. Just really try. Do you have anybody in your family that has diabetes?
Yeah, I have a couple aunts and my grandpa that's
And what do you
I
think the
have
normal
diabetes.
level is?
the normal level.
Yes.
I have no idea.
Yeah, that's totally fine. The actual normal blood glucose level is 70 to 120 milligrams, okay? So that's obviously something that you're gonna learn about, and later on, I'm gonna give you a couple of pamphlets for organizations that you can that could really help you,
Alright.
okay? And this is kind of a trick question, not really, but what do you think are the major effects and consequences if you do not maintain your blood sugar levels? at a normal rate?
I don't know, do you pass out or something?
Okay, well, much worse. Your cells and organs will be affected, and it could cause kidney damage as well, and leads to dialysis. So basically, if it leads to dialysis, it's just downhill from there.
Okay,
No.
so don't lead to dialysis.
Well, that would be a major consequence. Yeah.
Don't lead to
Okay.
dialysis.
It also increases risk of heart disease and stroke. So you don't want that.
Okay.
So in the next week or two, I'm gonna order your doctor to go ahead and he's gonna order a test for you, okay?
Okay.
And it's called the A1C hemoglobin, and it's gonna measure your levels over the past 3 months, okay?
Alright.
So whatever that they have not covered over recently, they're gonna go ahead and go back. Also, I have these pamphlets of agencies and community resources that can help you achieve your goal, okay?
Alright.
So the first one's gonna be Community Diabetes Care Center, and that's in Fresno. So it's not gonna be too far from here, but it's still gonna be quite a journey. And I'm gonna let you take that home. And then the other one is gonna be American Diabetes Association, and this one's in San Jose. So I do recommend you to plan a trip for this one, only because it's so much farther away. And this will give you so much more information about your diabetes and everything, okay?
Alright.
So you can go ahead and take those home. And then in a couple weeks, we're gonna meet up, and then basically I'm gonna check on your progression, okay?
Okay.
So how much have you learned and everything?
Alright.
Do you have any questions for me right now?
No, I do not. Are we gonna create a meal plan?
Yes, we are. We actually have an entire chart right here. We're gonna follow the My Plate plan. And then basically, it's gonna give you examples of there. And then we have all these handouts you're gonna go ahead and take home as well, okay? And basically, it divides everything up for you. So like say for fruits, this is just an example. You're gonna go ahead and do 2 cups, and then for vegetables, 2.5 cups. Grain, 6 ounces. Protein, 5.5 ounces, you know. Okay, so you can go ahead and skip those, and then you can just do breakfast, lunch, and dinner. But you should really try having 3 meals a day. And then I'm also gonna give you a log where you're gonna log everything for, say, the time that you did it, the amount you had, and then what you actually had, okay?
Okay.
So you're just gonna follow these guidelines, and then you're gonna go ahead and add them to your diary every single day.
Alright.
But keep in mind, you're gonna do it for 3 meals a day.
Okay.
Do you have any questions?
And so the My Plate plan is just for 1 day, right?
Yes, but you're gonna be doing it every single day.
Okay.
It's gonna be a lot of work, but this is what you're gonna have to do in the meantime.
Alright, sounds good.
Alright, is that on?
Now you all.
Okay.